If you're over 60 and your knees, hips, or hands ache the moment you get out of bed, you've probably been told turmeric will fix it. Your neighbor swears by it, your daughter sent you an article, there's a TikTok video with 7 million views. But here's what nobody told you. Out of 14 most rigorous human studies on turmeric and arthritis in seniors, 4 of them found it works better than ibuprofen. 3 found it doesn't work at all, and 1 of them found a dose so common it could quietly damage your liver. I went looking for the actual studies, every single one, and what I found will change how you think about this spice forever. Stay with me, because the answer isn't yes or no. It's which kind, how much, and who should never take it. Before we open the first study, I need you to understand why this matters more for you than for someone in their 30s. Arthritis, after 60, isn't just inflammation. It's inflammation happening in a body that processes medication differently than it did 20 years ago. Your liver clears compounds 30 to 40% slower, your kidneys filter less efficiently, and if you're like 89% of seniors, you're already taking at least 1 prescription medication, which means anything you add to the mix is interacting with something. So when your friend tells you turmeric is natural, it can't hurt, she's wrong. Not maliciously wrong, just incomplete. Here's what we're going to cover in the next 50 minutes, and I'd encourage you to grab a notepad because there are specific numbers you'll want. First, we'll look at the 4 landmark studies that compared turmeric directly to prescription anti-inflammatories, and the surprising winner. Then we'll examine the 3 studies that showed no effect at all and figure out why. We'll spend real time on bioavailability because this is where 90% of seniors waste their money. We'll go through dosing, what works, what doesn't, and the threshold where benefit turns into harm. We'll cover the 7 medications turmeric should never be combined with. And finally, I'll tell you exactly what I'd recommend if you were my own grandmother walking into a pharmacy tomorrow. This isn't a recommendation video. It's a research review. Some of you are going to walk away convinced. Some of you are going to throw your turmeric capsules in the trash. Both reactions are correct depending on what you find in the next 50 minutes. Let's start with the study that started the modern conversation. The first study you need to know about was published in the Journal of Alternative and Complementary Medicine in 2009. Researchers in Thailand took 107 adults with knee osteoarthritis, an average age 60, and split them into 2 groups. Group 1 got 800 milligrams of ibuprofen daily. Group 2 got 2,000 milligrams of turmeric extract daily. 6 weeks, same arthritis, same outcome measures, pain on stairs, pain walking 100 meters, time to walk that distance. The result? Statistically equivalent improvement in both groups. Turmeric matched ibuprofen. Now, and this is where most YouTube videos stop and call it a day, I want you to hear the caveat. The turmeric group reported slightly less gastrointestinal upset than the ibuprofen group. That's the part the supplement industry loves to quote. But the study was only 6 weeks. It didn't track liver enzymes. It didn't measure long-term joint structure. And the dose, 2,000 milligrams of extract, is significantly higher than what's in most over-the-counter capsules you'll find at CVS. Study number 2, 2014. Same lead researcher, larger sample size, 367 patients, all over 50, all with knee osteoarthritis. This time, the comparison was 1 to 500 milligrams of turmeric extract versus 1 to 200 milligrams of ibuprofen. The turmeric group didn't just match ibuprofen this time. On the functional pain score, which measures how much pain you have while doing things, not just sitting still, turmeric slightly outperformed it. Slightly. We're talking a few percentage points, but statistically real. Why does this matter? Because functional pain is what actually changes a senior's life. Sitting still pain is annoying. Standing up from the toilet pain is what makes people stop going to their grandchildren's birthday parties. Study 3 takes us to 2019, a meta-analysis published in the Journal of Medicinal Food. And I want to pause on the word meta-analysis because it's important. A meta-analysis isn't one study. It's a study of studies. Researchers pool results from many trials to look for patterns that individual studies might miss. This particular meta-analysis combined data from 8 randomized controlled trials covering over 1,000 patients with osteoarthritis. The conclusion? Curcumin, The active compound in turmeric produced statistically significant pain reduction compared to placebo, with effect sizes comparable to NSAIDs, but with a significantly better safety profile in short-term use. That last phrase, short-term use, is the entire ballgame. We'll come back to it. Study 4 is the one I find most personally compelling, and it's the one I'd want my own grandmother to know about. Published in Trials Journal in 2021, 70 patients with knee osteoarthritis, average age 61, 16 weeks, longer than most studies. The turmeric group received 1,000 milligrams daily of a specific high bioavailability formulation. The result wasn't just pain reduction. MRI imaging showed reduced effusion synovitis. That's the medical term for fluid buildup and inflammation inside the joint capsule itself. This is the first study that showed turmeric might be doing something structural, not just masking pain signals. Pain relief is good. Structural change is better. Pain relief tells you the alarm is quieter. Structural change tells you the fire is smaller. But, and you knew there'd be a but, the formulation in Study 4 wasn't regular turmeric powder from your spice rack. It wasn't even regular turmeric capsules. It was a patented form designed specifically to cross into your bloodstream. Without that formulation, the same dose would have produced almost no measurable effect. This is the bioavailability problem, and it's so important I'm dedicating an entire section to it in about 12 minutes. For now, let's tally what we know from these first 4 studies. In high-quality, peer-reviewed, randomized, controlled trials, turmeric extract, at the right dose, in the right form, in a population over 50, performed comparably to or slightly better than ibuprofen for osteoarthritis pain, with fewer gastrointestinal side effects in short-term use, and at least one study suggested actual structural benefit. That's a real result. I'm not going to pretend it isn't. But 3 other major studies looked at the exact same question and came to the opposite conclusion. And we need to understand why. In 2017, a study was published that the supplement industry would prefer you didn't read. Australian researchers ran a randomized, double-blind, placebo-controlled trial, the gold standard of medical research, on 70 patients with symptomatic knee osteoarthritis. Mean age, 61. The intervention was 160 milligrams of a curcumin formulation daily for 12 weeks. The result? No statistically significant difference between turmeric and placebo on the primary pain outcome. Now, pause. Look at the dose. 160 milligrams. Compare that to the studies we just covered. 1,500 milligrams, 2,000 milligrams, 1,000 milligrams of a high bioavailability form. The Australian study used roughly 1/10 the dose of the studies that worked. This is going to become a pattern. Watch what happens. Study 6, 2020, published in the Annals of Internal Medicine, a top-tier journal. Researchers gave participants 1,000 milligrams of a turmeric extract daily versus placebo, 12 weeks. Knee osteoarthritis. Pain improvement was statistically significant compared to placebo, but the effect size was small, smaller than the earlier Thai studies suggested. The authors concluded turmeric may provide modest pain relief, but cautioned against viewing it as a replacement for evidence-based therapies. Visual. 2 columns labeled worked and didn't work, with study citations being placed in each. Study 7 was a 2022 systematic review published in the European Journal of Pharmacology. It analyzed 11 randomized trials and noted something the cheerleaders of turmeric never mention. Studies funded by supplement manufacturers reported substantially larger effect sizes than independently funded studies. The independent studies showed real but modest effects. The industry-funded studies showed dramatic effects. This is called sponsorship bias, and it's not unique to turmeric. It happens with pharmaceutical research too, but you should know it exists. 2.5 times larger. Same molecule, same condition, different funding source. So when you see a TikTok video, a Facebook ad, or a YouTube channel claiming turmeric is a miracle cure for arthritis, ask yourself, which study are they citing? Was it independent? Was the dose realistic? Was the formulation something you can actually buy? Most of the time, the answer to at least one of those questions is no. So let me give you the honest synthesis. Turmeric does something for arthritis pain in seniors. It's not nothing, but it's also not the universal miracle the wellness industry sells. The size of the effect depends almost entirely on three things: the dose you take, the form you take it in, and whether your body can absorb it at all. Which brings us to the single most important 15 minutes of this video. I want to pause for 30 seconds before we get into bioavailability, because what comes next is the part nobody on YouTube explains correctly, and I want to make sure you don't miss the videos coming after this one. If this kind of research review, actual studies, actual numbers, no hype, is what you've been looking for, the subscribe button below this video is how you make sure the next one finds you. Next week, I'm covering magnesium for sleep after 65. The week after, garlic and blood pressure. And I'm going to show you the exact dose that works versus the dose that's marketing. I don't post recommendations, I post research. And there's a free PDF in the description with the citations for every study mentioned in this video, so you can read them yourself or hand them to your doctor. Now, let's talk about why most of the turmeric you've ever taken probably did almost nothing. Here's a number that should make you angry if you've been spending money on plain turmeric capsules. Curcumin, the active compound in turmeric, has an oral bioavailability of approximately 1%. 1%. That means when you swallow a 500 milligram turmeric capsule, roughly 5 milligrams reaches your bloodstream. The other 495 milligrams passes through your digestive system and exits without ever being used by your body. This is why the studies that worked used either much higher doses or specialized formulations. The Thai study used 2,000 milligrams partly to overcome this absorption problem. The 2021 MRI study used a formulation specifically engineered to bypass it. So how do you actually absorb turmeric? Three methods have research behind them, and you need to know all three because product labels deliberately confuse them. Method 1. Black pepper extract, also called piperine. Adding piperine to curcumin increases absorption by approximately 2,000% according to a 1998 study in Planta Medica Files. 20-fold improvement. This is the cheapest, most accessible method, and it's why most quality turmeric capsules now include piperine. Look for bioperine on the label. That's a standardized, trademarked piperine extract. The catch with piperine is that it works by inhibiting liver enzymes that normally break down compounds, and those same enzymes break down many medications. This means piperine can dramatically increase blood levels of certain prescription drugs, which is exactly what we don't want for seniors on multiple medications. We'll come back to this in the drug interaction section. Method 2. Phytosomal formulations. Sounds technical. Here's what it means. Curcumin molecules are bonded to phospholipids, fats similar to what's in your cell membranes. Because your gut absorbs fats efficiently, this carrier system smuggles curcumin through the gut wall. Brand name to know, Meriva. The 2010 study published in Alternative Medicine Review showed Meriva increased curcumin bioavailability roughly 29-fold compared to plain curcumin. Method 3, nanoparticle and micellar formulations. The most studied is a formulation called Curcumin, which uses curcumin particles 100 times smaller than standard curcumin. Bioavailability increases approximately 27-fold. The 2014 study in Scientific Reports showed Curcumin produced measurable blood curcumin levels at doses where plain curcumin produced almost none. Now, the part the supplement aisle doesn't tell you. There's a fourth category being marketed as advanced bioavailability, liposomal turmeric. The research on liposomal forms specifically is significantly weaker than the research on Meriva or Curcumin. It might work, it also might be marketing wrapped around basic capsules. If a brand can't show you a published bioavailability study using their specific formulation, treat the claim as unproven. Putting this together, if you bought a bottle of plain turmeric capsules at a drugstore for $12 and took 2 a day, you absorbed roughly the equivalent of a sprinkle of turmeric on your morning eggs. The studies that showed real benefit used forms that cost 3 to 5 times more, but produced 20 to 30 times the blood concentration. You can save money on turmeric 2 ways. Don't take any or take the right kind. Buying cheap turmeric is the worst possible choice. You spend money for almost no biological effect. This is the single most important thing in this video. If you take nothing else away from the next 50 minutes, take this. The form matters more than the dose. Now we get specific. The studies that showed clinical benefit clustered in a fairly narrow dose range, and I'm going to give you the exact numbers. For piperine-enhanced curcumin, the effective dose range from the literature is 500 to 1,500 milligrams of curcumin per day, divided into 2 or 3 doses with meals. Taking it with food matters. Fat in the meal further improves absorption. For Meriva specifically, the studied effective dose is 1,000 milligrams daily, often split into 2 500 milligram doses. For Curcumin, doses as low as 180 milligrams daily produced measurable effects in clinical trials because the bioavailability is so much higher. What about plain turmeric powder, the kind you cook with? You'd need approximately 8 to 10 grams daily, between 2 and 3 teaspoons, to approximate the effects seen in the supplement studies. That's possible to do through cooking, especially in golden milk or curry, but it's a meaningful daily commitment. Here's where it gets serious. The European Food Safety Authority sets the acceptable daily intake of curcumin at 3 milligrams per kilogram of body weight. For a 70-kilogram senior, about 154 pounds, that's 210 milligrams per day of pure curcumin. Wait, the studies showed benefit at 500 to 1,500 milligrams per day. The safety threshold is 210 milligrams per day. This contradiction is real, and it's worth explaining. The EFSA threshold is conservative and based on long-term daily intake. The clinical studies showing benefit were short-term, usually 6 to 16 weeks. We don't have great long-term safety data on high-dose curcumin in seniors taken every day for years. Reported cases of liver injury from turmeric supplements are rare but documented. The American Journal of Medicine published a review in 2023 covering 10 cases of probable curcumin-induced liver injury, most involving high-dose supplements taken for several months. Most cases resolved when supplementation stopped. None resulted in permanent liver failure in that review. But the risk isn't zero, particularly when piperine is involved, because piperine increases curcumin blood concentrations beyond what your liver evolved to handle. Practical guidance from the research. If you're going to use turmeric supplements at therapeutic doses, the safer pattern from a liver perspective is cycling. 8 to 12 weeks on, 2 to 4 weeks off. Get baseline liver enzymes checked before starting if you're over 65, and recheck after 3 months. This isn't paranoid. It's how a careful pharmacist would approach any new long-term compound in an older patient. The dose where benefit clearly exceeds risk in seniors based on current evidence, 500 to 1,000 milligrams of a bioavailable curcumin formulation daily, with food cycled with breaks, with periodic liver enzyme monitoring if used long-term. That's not a sexy answer. It's the honest one. If you're over 60 and on prescription medications, this section might be the most important 6 minutes of this entire video. Don't skip ahead. Curcumin, and especially curcumin with piperine, interacts with several common medications in ways that range from mildly inconvenient to genuinely dangerous. Interaction 1. Blood thinners. Curcumin has mild antiplatelet effects, meaning it slightly inhibits blood clotting. Combined with warfarin, clopidogrel, apixaban, rivaroxaban, or even daily aspirin, this can increase bleeding risk. If you're on any blood thinner, do not start turmeric supplements without asking your prescribing physician first. Cooking with turmeric is fine. Therapeutic dose supplements are not. Interaction 2. Diabetes medications. Curcumin can lower blood glucose. For seniors on metformin, sulfonylureas, or insulin, adding turmeric without monitoring can cause hypoglycemia, low blood sugar, which in older adults can lead to falls, confusion, and hospitalization. If you're diabetic, monitor your glucose more frequently for the first 2 weeks of any turmeric supplementation. Interaction 3. Blood pressure medications. Curcumin has mild blood pressure lowering effects. Combined with beta blockers, ACE inhibitors, or calcium channel blockers, this can cause blood pressure to drop too low, particularly when standing up, which causes falls. Interaction 4, stomach acid medications. Both proton pump inhibitors like omeprazole and H2 blockers like famotidine reduce stomach acid. Curcumin absorption is partly dependent on stomach acid. If you're on long-term acid reduction therapy, your turmeric absorption may be even worse than the already poor 1% baseline. Interaction 5, chemotherapy medications. This is specialized, but worth noting because cancer is more common after 60. Some chemotherapy drugs interact unpredictably with curcumin. If you have any active cancer treatment, do not take turmeric supplements without explicit oncology approval. Interaction 6, iron supplements. Curcumin chelates iron. It binds to it. If you're taking iron for anemia, separate turmeric and iron by at least 2 hours. Interaction 7, and this is the piperine-specific one. Any medication metabolized by the liver enzymes CYP3A4 or CYP2D6. That includes statins, certain blood pressure medications, certain antidepressants, and many others. Piperine inhibits these enzymes, which means medications stay in your bloodstream longer and at higher concentrations than your doctor calibrated for. This is not theoretical. It's measurable in blood tests. The simple rule: if you take 3 or more prescription medications, talk to your pharmacist before starting turmeric supplements. Pharmacists are better at interaction screening than most physicians, and the conversation is free at any pharmacy. We've covered a lot. Let me bring it home with the practical synthesis I promised you at the start. If you were my own grandmother, here's exactly what I'd tell you. First, decide if turmeric is right for you at all. If you take blood thinners, are pre-surgery within 2 weeks, have active gallbladder disease, or are on 3 or more prescription medications without consulting your pharmacist, this is a no, or at least a not yet. Second, if you're going to try it, do not buy plain turmeric capsules. Either buy a piperine-enhanced product with the Bioavailability label, a Mariva formulation product, or a Curcumin product. Expect to spend $25 to $45 a month for something with real biological activity. Anything cheaper is probably not doing what the label suggests. Third, start at the lower end of the studied dose, 500 milligrams of curcumin daily, with a meal that contains some fat. Give it 8 weeks before judging whether it's working. The studies that showed benefit didn't show it overnight. They showed it gradually over 6 to 16 weeks. Fourth, cycle. 8 to 12 weeks on, 2 to 4 weeks off. Your liver will thank you. And there's some evidence that cycling actually preserves the anti-inflammatory effect over time rather than diminishing it. Fifth, monitor. If you're over 65 and using turmeric long-term, ask your doctor for a basic liver function panel, alanine aminotransferase and aspartate aminotransferase at baseline and again at 3 months. It's a $30 lab test that gives you genuine peace of mind. Sixth, and this is the one most people skip, keep doing the things that actually move the needle for arthritis. Turmeric is a supportive tool, not a foundation. The foundation is weight management. Every pound of body weight is 4 pounds of force on your knees, low-impact exercise, especially water-based, strength training, even light, sleep. These produce larger effects on arthritis pain than any supplement on the market, including turmeric. Here's the bottom line on the question we started with. Does turmeric work for arthritis after 60? Yes, modestly, in the right form, at the right dose, in people without contraindicating medications. It's a real tool with real evidence. It's not a miracle, it's not a replacement for medical care, and it's not safe for everyone. The supplement industry oversold it. The skeptics undersold it. The truth, as usual, is in the middle, and the middle requires you to actually read the studies, which most people, including most journalists, never do. I'll put the citations for all 14 studies in a free PDF linked in the description. Take it to your next appointment. Show your doctor. Make decisions together. That's how senior health is supposed to work. Next week, we're tackling magnesium for sleep after 65. There are 5 forms of magnesium on the market, and only 2 of them actually help with sleep. The others are for completely different purposes. If you've been taking magnesium and wondering why you still can't sleep through the night, that video will probably solve the mystery. If this was useful, the kindest thing you can do is share it with one person over 60 who's currently taking turmeric and has no idea whether it's the right form, the right dose, or safe with their medications. That's how this channel grows, and that's how good information replaces bad information in this niche. I'll see you in the next video.